Dr. Ian Shtulman.
Thank you so much. We chiropractors work with the subtle substance of the soul. We release the prisoned impulse, the tiny rivulet of force that emanates from the mind and flows over the nerves to the cells and stirs them into life. We deal with the magical power that transforms common food into living, loving, thinking clay, that robes the earth with beauty and hues and scents the flowers with the glory of the air. In the dim, dark, distant long ago, when the sun first bowed to the morning star, this power spoke and there was life. It quickened the slime of the sea and the dust of the earth and drove the cell to union with its fellows, producing countless living forms. Through eons of time, it finned the fish and winged the birds and fanged the beasts. Endlessly it worked, evolving its form until it produced the crowning glory of them all. Through tireless effort, it blows a bubble into each individual life, and then silently, relentlessly, dissolves the form, absorbing the spirit into itself again. And yet you ask, can chiropractic cure appendicitis or the flu? Have you more faith in a knife or a spoonful of medicine than the innate power that animates the internal living world? I was in first quarter of chiropractic college when I first heard that. Now, I grew up as a second-generation chiropractor getting adjusted from my first day I was on this planet. And I never understood what it was that we did as chiropractors. I always viewed chiropractic as a modality to address uncomplicated musculoskeletal pain, because that's how my dad practiced for 30 years. And so I'm sitting in chiropractic school, and I hear this for the first time, and all of a sudden, I start to think about all of the times my dad adjusted me and how that adjustment changed my life. And I started to understand chiropractic on a whole nother level. A few weeks after that, we had a business class on the weekend. And Dr. Ed Plent shared something that stuck with me to this day. It's Life magazine from 1965, the first color photos of a developing baby inside of its mother's womb. And he used this as a way of demonstrating the innate intelligence that BJ had just referenced. The first photo, I apologize in advance, is just sperm. You can see the photo on the bottom. All of the sperm are swimming in the same direction. The top photo on the left, all of the sperm are scattered. They're all going in different directions. There's no organization. The only difference between those two photos is an egg available to be fertilized. That these half cells of genetic potential have an intelligence to direct them where to go, how to get there, what to do when they get there, and when to even bother trying. And this half cell from a sperm meets up with this half cell from an egg to create one single human cell. And it divides, differentiating, forming the heart, the lungs, the kidneys, fingers, toes, nails that go right up to the tip of the finger and toes and then stop growing until they're exposed to oxygen so you're not giving birth to Wolverine. Eyelids that grow to protect the eyeballs and the changing amniotic fluid. All of this happening with the nervous system as the first system to develop and regulate and mediate the entire process. And you look at this and you say just how amazing this intelligence must be to create this and to have this happen so successfully, so consistently. And you don't have to go to school for it. You don't have to know what's going on inside you. And to be honest, the dumbest people in the world have babies every day. And so you realize this innate intelligence is being fully expressed in every situation. And I just became so immersed in this. I said, this is what B.J. Palmer was writing about. This is what he was referencing when he talked about the innate power that animates the internal living world. Now, once that baby is ready, we go through the normal process of birth. And it starts with baby being in a good position. So I've got my little assistant here. She's been with me for now 17 years since I was in chiropractic school. And when we look at baby's position, right, we think about baby being in that head down position, slightly flexed so the crown of the head is engaged right up against the cervix. Now, the thing that's really cool is this cervix doesn't just hold baby in. That's what it looks like. You can see it's super thick. The Oz is really small. That's where baby eventually comes out. Every time I look at the cervix, though, all I see are those donuts. Every time in a gas station, I laugh like, oh, there's a bag of cervixes. But what's really neat about this is that cervix, you can see on the picture on the left, that cervix right here is holding baby in. It's super thick and strong and it's closed off. But what happens is baby's head, when they're in that position, engaged perfectly, creates this consistent pressure. And the cervix starts to thin out and it starts to stretch. But it doesn't just disappear. The cervix actually changes. And what you can see here is all of this, all of that thick tissue migrates towards the top of the uterus, thickening the fundus, making the uterus stronger and more prepared to push baby out. And that process takes weeks. We need to stop thinking about birth as an event and think about it more as a process. Right? It takes weeks to continue and help push both mom and baby together as a team towards a successful birth. So as baby's there, what's really cool is that head puts pressure, the cervix thins out, the fundus thickens, but as the cervix starts to stretch, it sends signals through the nervous system to the brain telling it, okay, we're ready. And then the brain releases oxytocin, which floods the uterus, causing it to contract, pushing baby deeper. More stretching, more signal, more oxytocin, more contraction. And it builds and it builds and it builds. For those of you who are getting ready for boards, it's a positive feedback loop, right? And what happens is as baby's going, because baby's head is longer this way and the shoulders are longer this way, they can't just drop into the pelvis. They have to corkscrew. So the head drops in, and then baby rotates 90 degrees, and then the shoulders drop in. And then the head comes out, and then rotates 90 degrees, and then the shoulders come out underneath the pubic bone. And baby is brought into the world, and if you place baby on mom's chest, the baby will naturally, on its own, start to crawl towards the breast and feed for the first time. All of this stuff happens. And I'll show you something that's, I think, one of my most fascinating parts of the entire birth process is as all of this is happening, right? Baby's going through this descent, this rotation, this extension, they're all going. The pelvis has to be able to dance and move with baby to make room. Right? This isn't just like a process for baby to get pushed out. There's a dance that mom and baby go through to make that possible. And in addition to the pelvis moving, the pelvic floor muscles have to be able to stretch symmetrically. And as baby's working through, mom gets this surge of sympathetic hormones, this fight or flight, this animalistic urge to bear down and push baby out. But that same sympathetic hormone surge causes what's called the fetal ejection reflex. And baby will actually push off and arch back to be able to get underneath the pubic bone. And all of that happens without us having to think about it. Think about how amazing that is. So why doesn't it go as successfully as it should, as often as it should? Well, first off, I always viewed pregnancy and birth as the full expression of innate intelligence. To me, when I look at this process, I see the potential of what happens in life, right? With this innate wisdom guiding the way. But we get in the way of it. We, meaning humans, get in the way of normal progression of labor and birth. And there's a medical term for it. It's called dystocia. It literally means difficult labor. It's responsible for 60% of C-sections in the United States. I'm going to present, there's 3 reasons for dystocia. The first is emotional. Let me ask you a question. I know I can't see everybody, but show of hands, how many of you have children yourself? Awesome. Keep your hand raised if prior to the birth of your child, you had seen a normal natural birth. Not as many, huh? The vast majority of women in this country, in Western society, have never experienced a birth in their life prior to their own. If you would go back a couple hundred years, you'd be in a situation where, as an expectant mom, you had been to dozens of births in your village. You would have watched your mom give birth to your siblings, your aunts give birth to your cousins, your neighbor gives birth to your friends. It would have been just your turn, a normal, natural part of the process. But instead, we hide birth in a hospital behind closed doors, and the only experience you've probably had with birth is either through media presented as a comedic plot point or a tragedy. So what happens? You go into birth, you go into your pregnancy filled with fear and anxiety. We end up in a situation where your visits with a provider are less about how to create the best internal environment for baby, and it's more focused on let's look to see if you have a disease. Right? The fundamental difference between medicine and chiropractic. Medicine, by its nature, is the diagnosis and treatment of disease, primarily using drugs, radiation, and surgery, and there's nothing wrong with it. If you have disease, it's probably a good idea to address it. But it doesn't do anything to actually promote, maintain, or restore health. It doesn't do anything to help a mom grow a healthy baby in utero. It doesn't do anything to prepare that mom for birth. It doesn't do anything to support that mom and baby as they transition into this new life together. And as a result, we have births that are overly medical, and we have moms going through this with fear, stress, anxiety, doubt, the entire stage. Preconception, can I get pregnant? My mom's been telling me my whole life that I tore her in half. I see all these depictions of birth being scary and dangerous, and I'm terrified. And then you go into your medical visits, and every step of the process is looking for more problems, scaring you about possible issues. And women feel alone and unsupported the entire way. Then there's environmental dystocia, being in a place that's not supportive. And I'll give you an example. In South Florida, we have sea turtles, right? Sea turtles come on and lay their eggs on the shore, cover up their nests, and then they go back into the ocean. Well, a few years ago, my wife and I went to a state park, and we sat in this room late at night, and all of a sudden somebody comes up and says, "Hey, we got one. They just beached. They're here. Come on, follow us on." And we all walked down. He had like a red light on his head, and we all like tiptoed down the sand, and then we came up right behind the sea turtle, and we just like camped out. I mean, it was as close as you and I were together, right? And we're just sitting here in silence as this turtle is just plop, 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 egg after egg after egg into its nest. And then off in the distance, we hear an ATV buzzing along the beach. And as it gets closer, that turtle opens her eyes, lifts up her body and braces, and the eggs completely stop. And they freeze. And we sat in silence for about 3 or 4 minutes until that ATV was off into the distance. And she closed her eyes, relaxed her body, plop, 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 and finished her nest. That's an experience that affects humans as well. Because when moms are in a situation where you're able to just relax and feel safe and comfortable, the normal process of birth can progress. But when you're in a situation where you feel scared, isolated, and then every few minutes a nurse is popping into the room asking you on a scale of 1 to 10, how much pain are you in? And let's turn on all of the lights and let's test all of the things. It completely takes you out of the situation. And that's how most women experience birth, right? Here are the most common interventions that we see in labor. First off, as women are progressing through, besides all of the prenatal testing that they go through, all of the day-to-day testing to evaluate and check on all of the diseases that mom may be developing over the process. We get towards 37 weeks when we're technically full term, and with each passing week, women get more and more pressure from their OB or from the midwife. They want to start stripping membranes where they go up there and they separate the amniotic sac from the interior of the cervix, trying to help irritate the tissue and initiate labor. 31% of births now include some sort of cervical ripening agent or induction, whether it's Cervidil, Pitocin, Cytotec, something that essentially forces the body into a labor that it's not ready for. Now remember, we talked about the thinning out of the cervix and how that tissue migrates to the top of the uterus to thicken the fundus and prepare the body for those contractions. That's a slow, steady process that takes weeks. So what happens when a mom goes into labor at 39 weeks, or she goes to the hospital for an induction, and she's a first-time mom, which normally on average takes about 10 days post-dates to really go into labor, but now she's expected to be given Cytotec, and you need to progress at a set schedule as if you were already ready. And so what we end up with is a situation where the cervix swells, where the descent takes longer, where moms now expect to get pain relief and an epidural, which limits their movement. So now instead of being able to use gravity and move their hips with baby, now they're forced to lay flat on their back with a monitor strapped to their body. And no, you can't move because it's going to be difficult for us to measure your heart rate from a central station. So we're going to have you stay in bed with this monitor strapped to you. And if it does move or shift, we're going to come in and yell at you that you're moving too much. And then every few hours, we're going to have somebody come in and we're going to do a vaginal exam to check how far along you are. And by the way, I've been in birth rooms where I've seen OBs walk into a room, not introduce themselves, not make eye contact, and immediately put their fingers inside a woman's vagina. And this is considered the standard for medical care. If you're not progressing quickly enough, you're now expected, now we have to give you more and more things. You're not allowed to eat, so we're going to give you IV fluids. So now you're spending your entire labor walking around with an IV bag attached to you. We're going to give you IV antibiotics in case you're GBS positive because we're terrified of the risk that your baby might develop a group B strep infection. Never mind the fact that we're destroying the bacterial flora that make up the vagina and are the first and most important meal your baby's ever going to receive being exposed to that. We have the supine lithotomy position. For those of you who don't know, that's where women lay on their back with their legs in stirrups. And I want everybody to do this real quick. Sit. I want you to put your hands underneath your butt. Right? Hands on, ischial tuberosities. You can feel them? Here's what I want you to do. You're going to lift your legs and you're going to separate your knees and get into that position. My apologies to the front row. What happened to the ischial tuberosities? They go in. They close. So why do women give birth on their back with their knees bent and raised in the air like that? Because it's convenient for the providers. So now I want you to do this. I want you to put your hands underneath your butt. And I want you to arch your back to stick your butt out a little bit. And I want you to bring your knees in. What happened? They separate. So we're in a situation that out of convenience for the provider, we're expecting moms to go into labor at a certain point, progress at a certain point, not move, and be flat on their back in a position that closes their pelvis about 30%. And because moms, about 70% have an epidural during their birth, they can't feel what's happening to them. So instead of listening to their body and trusting the process to bear down when they're ready, they're being given Pitocin to force contractions, and they're now getting coached pushing, being told to bear down before their pelvic floor is stretched and it's ready for it. And that's why we end up with so many women having tears and pelvic floor injuries. And this is why so many women can't hold back urine when they're laughing later on in life. All out of convenience for the doctors instead of the support for the mom and the baby. And by the way, you see all these things? This is standard. Everything that's in bold right here, this is what you should expect your patients to come in with after they've given birth. If you have no interest in taking care of pregnant women, totally get it. If you have no interest in taking care of babies, totally get it. But if you're going to take care of women at any point in their life, especially postpartum, they'll probably have been through this. And take that into account when it comes to addressing subluxations anywhere in their spine or pelvis, because this is what they've been through. And even if you don't want to take care of the women postpartum at any point in their life, which you're going to have, unless you're exclusively seeing, single men, right? You're going to be in a situation where they're going to have patients who have families, patients who have children, patients who have loved ones who are expecting or have children, and they deserve chiropractic too. Doesn't mean you have to be the one to provide care to them. But I guarantee you there are students in this room who want to take care of those people and would be happy to take those referrals. In my practice, I don't take care of elite athletes. I don't take care of people with Medicare. I don't take care of car accidents. My practice is pretty much exclusively pregnant women, children, and young families. I have chiropractors in my area who send me all of their pregnant women, and I send them all of my car accidents. I think we can only do better by recognizing that chiropractic has specializations, and instead of having that poverty mindset that makes us think that we need to take care of every single person and be all things to all people when they walk through our door, recognize what we do and what we do that nobody else in the world does, and deliver that effectively. And then help create relationships in our communities that we can refer them to for other things, right? That's how I approach my practice. Doesn't mean you have to, but if you don't want to take care of pregnant patients, that's totally okay. Find a chiropractor in your neighborhood who wants to. It'll be one of the best relationships you make in your community. So after baby's born, we're in a situation where we're immediately clamping the cord. 30% of baby's blood still in the placenta, still actively throbbing, pushing blood through the umbilical cord, and we immediately clamp it. Because as soon as the doctor gets the placenta out, their job is done and they can go home. We don't trust that babies can clear out that amniotic fluid, so we immediately suction. We separate mom and baby. Instead of that physical connection, we rush baby off to take him and get him cleaned up and covered, right? Because God forbid baby comes out and they look a little yucky because they're all covered in vernix, right? You can see, look at this baby. It's like they're covered in cake batter. That's the vernix that helps protect baby with antibacterial, antiviral, antifungal protection, that we immediately wash all of it away, scrub them down so they can look clean. When my boys were born, they didn't get their first bath for like 2.5 weeks. We let all of that vernix rub into them and be absorbed and utilized and protect them for those first few weeks. We do erythromycin ointment, right? Antibacterial ointment that goes in the eyes. If you've ever seen friends or family, they post photos of their newborn, and you see their eyes are like a little bit glossy, it's because they rubbed an antibacterial ointment inside their eyes. Why? For chlamydia and gonorrhea. You'd say, well, don't we test women to see if they've got an STD? Yeah, of course we do. But the system does not trust women. They don't care if you're negative for hepatitis B. They don't care if you're negative for chlamydia and gonorrhea. They don't trust you not to go out and contract chlamydia and gonorrhea before you give birth. So they'll just do it to everybody. All of this happens. This is standard. This is the norm. This is what your patients are going through. All in the name of trying to make birth better. Williams Obstetrics talks about the third type of dystocia, what I refer to as neurostructural dystocia. And when Jeannie Ohm taught the Webster technique, she used to describe the 3 Ps, which reference power, the strength and rhythm of the contractions pushing baby deeper and deeper into the pelvis. Passenger, the position of baby and their ability to move and rotate. And then the passageway, the ability of the pelvis, both bony and soft tissue, to stretch and open up and make way for that. Well, guess what happens? Decades of accumulated physical, chemical, and emotional stress, right? Little girls growing up, learning to walk, falling on their butt, jamming their pelvis. That pelvis is now restricted in a subluxated pattern, which for the rest of that life, that child is learning to move and grow and adapt through that space. So what we end up with are decades of muscle memory and movement patterns that have fundamentally altered the way that child has learned how to move through life. And as the spine and pelvis are molding and developing and maturing, they now reinforce that subluxated pattern. That's now their default. So you ever wonder why adults often need so much care in the beginning of your care before they start to hold their adjustments? It's because they've been living in a subluxated pattern with muscle memory and movement patterns and bony molding of those joints in that pattern their entire life. And then you expect them to hold their adjustment and feel better after one adjustment? I think in our profession, one of the things that we don't do is we don't honor the significance and the chronicity of the subluxation and how devastating it is to how that person has lived every day of that life since that first subluxation appeared. And if we honor the wisdom of the body and trust that through our specific analysis and specific adjustments, we can allow that person to better express and adapt to an ever-changing internal and external world, that it allows the body to heal more efficiently and effectively, that things get better. But rarely does it happen with one adjustment. I know you have speakers at every stage that you've probably ever, sat in front of who tell you these miracle stories, and don't worry, I've got one coming up, right? Tell you these miracle stories of a chiropractic adjustment transforming a life. And yeah, it happens. But you know what's just as amazing? Keeping somebody well adjusted consistently enough to give their body time to heal. And that's what you're going to see most of in practice. So, people come into pregnancy already subluxated, and that subluxation, as a result of this shift in the pelvis, pulls on the uterus, creating tension that limits baby's movement, that restricts their position. Now, as baby is corkscrewing through the birth canal, you're going to get less movement in the pelvis to adapt, less support to help make the way for baby to get out. You have pelvic floor muscles that are now tighter on one side than the other, so the pelvic floor can't stretch nearly as well as it needs to during birth. Heidi Havoc published a research paper a few years ago that took two groups. One group, they were all pregnant women. One group received chiropractic care, the other group did not. What they found was that when they did EMG tests, right, surface EMG on the pelvic floor muscles, that those pelvic floor muscles were 30% less tense after a chiropractic adjustment. So imagine what's possible if women have the opportunity to not just have a well-adjusted pelvis to create the best environment for baby to grow, that can have a pelvis that's moving and adapting with baby, that can have a pelvis that's able to stretch and open because the pelvic floor is doing what it's supposed to do, and then a nervous system that can regulate and coordinate the onset and progression of those contractions. How different do you think birth would be? Because what we know is that subluxation leads to more stress for mom and baby, more complications, and more intervention, and that's where we are today. When I graduated chiropractic school, I opened up practice, and I had done a lot of work with the ICPA when I was in school to really try to master my understanding of pregnancy and pediatric chiropractic. And I opened up practice, and at the same time I was opening up practice, the first freestanding birth center in Palm Beach County was opening. And so I went out, and here I am, at the time I was 25 years old. I just got married. I didn't have children of my own. I had to grow a beard to look old enough so people wouldn't ask me how old I was. But because my understanding of this process and the role chiropractic can play in supporting both parents and babies during their pregnancies and birth, I was invited in to become the chiropractor at the birth center. And I started working with moms, and I started, taking care of families and young kids. And I was in the office on a Saturday morning. I was finishing up my normal hours, and I get a phone call from one of the doulas. And she says, Dr. Ian, is there anything that you can do to support a mom in labor that things stop progressing? And at the time, I had only been in practice a couple of months. I didn't have any experience adjusting in labor. But I knew that if she was subluxated, correcting that subluxation with a specific adjustment would allow her body to better regulate and adapt and coordinate that birth, and that things would be better as a result. That wasn't a question for me. That wasn't theoretical. I knew it with every bit of my soul. So I said, yeah. And so they said, okay, we're at the hospital. This mom's been in labor. Well, she's not really in labor. Her water broke 24 hours ago. There's nothing happening. She hasn't felt any sort of pressure, any sort of activity. She wasn't contracting at the 12-hour mark, so we brought her to the hospital. She's been on Pitocin for the last 12 hours, but there's nothing happening. Baby's really high, so, we think about engaged as 0, and then there's like +1, +2, +3 is crowning. Baby was still, -2. Super high, not engaged yet. She was stuck at about 4 centimeters. Just in this place where the OB was ready to do a C-section. And with the doula, because she had just met me through this birth center, said, well, would you mind if the chiropractor would come and adjust her? And the OB says, yeah, sure. Go ahead, bring the chiropractor. And so I went to the hospital, and I'll never forget this mom, her name is Trisha. She walks up to me, and she's wearing her gown. It's tied up in the back. She's holding her IV bag, and she goes, hi, Dr. Ian. It's so nice to meet you. Thank you so much for coming. And if you've ever been to a birth, you can pretty much tell how far along somebody is by how many pieces of clothing they're wearing and if they even acknowledge your presence, right? And so there was nothing happening with Trisha. She'd never been adjusted before. I didn't have any of my normal technique stuff. I didn't have my table. I didn't have pregnancy pillows. I didn't have my scans. I didn't have my posture grid. I didn't have anything to assess other than my hands. And so I'm trying to think back to like third quarter in school, and I'm like, all right, there's 8-point check for motion palpation. So I had to put her fingers on the wall and march in place as I felt. And I did my best to find objective criteria to adjust. Right? What's my listing? And I didn't have anything to adjust her with, so I had her lay on all fours, and I basically stood over, and for all of you NUCA people, I did like a tricep pull style of adjustment, and I just held, and I kind of convinced myself that I made a difference. Sure enough, everything was moving better, and I looked at her, and I said, you're going to have a baby soon. And I walked out, and I spent the rest of my day staring at my phone, absolutely convinced I just killed this mom and baby and my life was over. Because I didn't know what I was doing. I just knew that I would adjust her. I get a phone call the next morning, and they said, after you adjusted her, about 20 minutes later, Trisha had a second release of fluids. She started feeling pressure in her pelvic floor for the first time. Baby drop went from -2 to +2. She went from 4 centimeters to 7 centimeters. She started contracting on her own, and she had a baby vaginally a couple hours later. And it was in that moment where, for a little bit, I was like, I'm hot shit, right? Look at this, I've got life coming out of my pisiforms. And then I kind of did a little ego check on myself, and I said, wait, the only thing that I did that was different was being there, was being available to step in and adjust this mom in labor. That's the only thing that I did that was different from anybody else, right? Is that this mom had an opportunity to deliver that, to have that adjustment, and it changed the course of her birth. And so my mission, the reason why I started teaching for the ICPA, the reason I started going to college campuses and interacting with students is because I want to make chiropractic available at every birth for every parent and every baby everywhere. That's my personal mission. By the time I retire, this is what I want to see. Because birth matters. Those of you who have had a baby, you absolutely know that that birth doesn't just register as an experience you've had in your life. It fundamentally changes your identity of self, who you are as a person, what your body was able to do. I have never in my life, I've been with my wife now for 21 years, I have never seen her more confident and self-assured and certain about what she can do and the power that she has in her body than when she held our son in her arms after having a home birth. She says, I was able to do this. And I believe every woman should have an opportunity to experience that. But here's the thing, it's not just about that emotional confidence. We know that the birth experience influences epigenetic expression. So there's this hypothesis that was published about 10 years ago. It's called EPIC, the epigenetic impact of childbirth. And what it essentially says is there's a Goldilocks range of stress that babies have to go through in order to prime their nervous system and ensure that their epigenetic response is prepared for the world around them. So too much or too little stress actually contributes to what they refer to as pathological priming of their nervous system. And there are 2 quotes that I really love. The EPIC hypothesis proposes that reduced or elevated levels of cortisol, adrenaline, and oxytocin produced during labor may lead to fetal epigenomic remodeling anomalies which exert influence on abnormal gene expression. For everybody who believes that genes are destiny, you have an ability to influence the expression of those genes by altering that birth experience. And that sets the tone for the rest of that child's life. The importance of the laboring of labor. It should be work. It's stress that's activating baby to enter into this world on a level of consciousness that they otherwise wouldn't have. The laboring of labor as a complex salutogenic phenomenon that is essential priming agent in the dynamic process of labor and birth. Birth matters. These kids come out into the world after experiencing fear and anxiety their entire pregnancy, and they're forced in through medical intervention when they're not ready, and then they're being pulled and torqued and twisted out, and then we expect them to be perfect. And then we wonder why they're chronically sick. And guess what? We have the opportunity to affect things, because in this paper, they talk about the 3 aspects of this impact. And they talk about in utero environment and the health and environment that baby is growing in during pregnancy. Well, we can affect that. They talk about the actual birth result, right? The intrapartum health. That's something that we can affect. The EHH is the extended hygiene hypothesis. It basically says that we need to be exposed to bacteria in order to prime our immune system, our gut, our digestion, right? And we can affect that by making sure that more moms have vaginal births. And then obviously, as that child is exposed and how well they adapt to the world around them afterwards. Chiropractic can address all of those things. The difference is, are you going to take the time necessary to prepare yourself when you get that phone call? Are you going to spend the time in school mastering your technique, your analysis, your philosophy, your understanding of physiology, so that when you get that phone call, that you can step in with a level of certainty to be willing to adjust that mom and make a difference for the rest of that child's life? So when I was in school, I'm going to give you a couple things. I know I only have a few minutes. I'm going to end with a story. Bear with me, all right? Be the first one in and the last one to leave your technique labs. Take every opportunity to get your hands on fellow students and learn. Sit in your clinic and watch other students learn, figuring out, adjusting, and grow from all of those experiences. Take every opportunity right now when you're in school to learn from the doctors who travel here on their own dime to share from this stage and try to pour into you. Visit doctors' offices, visit chiropractors around the world, wherever you go, and shadow and see how they do it. You'll find things that you like, you'll find things that you don't like, but you're never going to get a better opportunity than you are right now as a student to be exposed to that. You have phenomenal leadership at this school. You have phenomenal opportunities that you will not have the moment you walk across that stage. Take that time now. All right? I personally, this is my email if you want to reach out to me, right? It's super simple, ian@icpaforkids.com. But I want to share a story of kind of the totality of how this influences things. I had this little, I had this mom come to me. She was referred by an OB that I work with. Her name is Sydney. And Sydney came into the office at 36 weeks and her baby was breech. And we explained that we don't turn breech babies. Our job is to restore normal neurobiomechanics by correcting that subluxation and allowing your body to work better, and that'll create more room for baby to turn. So what happened? We adjusted her, and baby turned, right? Cool story if it was just that. Then Sydney was in labor, and things started to stall. She was 4 centimeters, very little things happening, and this was at the height of COVID. This was June of 2000, right? So right at the height of COVID. But because of my relationships that I had spent with OBs and the maternity director, they snuck us into the hospital to come and see this mom. At a time when hospitals were closed to doulas, to partners, to any support or visitors, they brought us in to adjust this mom. And we held a Logan basic contact. We adjusted the sacrum, and as we're holding that Logan basic contact, releasing the sacrotuberous ligament, she lets out this moan, and they come and check her, and she's now 9.5 centimeters, and she pushed out a baby. And that by itself would be a cool chiropractic story. But she texts me the next day and says, "We're still in the hospital. They think my daughter has bilateral hip dysplasia." And you can see here, this is how she was. You notice how her onesie is unbuttoned? It's because her legs were locked in this position. They physically could not straighten them out. So they did a CT, and they said she's got bilateral hip dysplasia. We're going to get her fitted for a brace. She's going to spend the next couple months in that brace, and then we'll do PT, OT, and a bunch of therapies to make sure that she's ready and hopefully she'll be able to live a normal life after that. And I said, "Listen, Sydney, why don't you come see me? I'm not going to adjust her hips, but I want to get her checked." And so here I am. This is the first adjustment. I'm making a gentle pressure on right C1. And as soon as I finish, Sydney reaches over and picks up Charlie, and her legs completely drop down. The next day, they went back to get the brace put on, and there was no evidence of hip dysplasia. And they didn't need to do brace. They didn't need to do any sort of intervention or therapy. And she's now, 5 years old, completely developing normally on schedule. Now, This isn't saying that chiropractic is a treatment for breech babies. It's not saying chiropractic is a treatment for dystocia. It's not saying chiropractic is a treatment for bilateral hip dysplasia. It's saying that the human body has tremendous potential, and we as chiropractors have the opportunity to influence the expression of that potential through a specific chiropractic adjustment. This child never had hip dysplasia. She had a subluxation that created so much tension in her body from a difficult, stressful pregnancy and birth that the moment we did that adjustment, it freed all of that. And we're able to see that innate power that animates the internal living world be fully expressed. Thank you guys so much for being here. I really appreciate it.
Thank you, Dr. Ian.